Health News tonight, a rescue drug for people addicted to opioids.
We're talking about people hooked on anything from prescription pain meds to heroin. News 8 medical reporter Jocelyn Momente in our New Haven newsroom tonight with more on this life-saving medication. Jocelyn.
Sonia and Darren, in our state, there is an average of nearly 1 death a day linked to a drug overdose, increasingly due to prescription drug abuse. A law passed last year makes a life-saving medication more readily available.
This is the rescue drug for people addicted to prescription pain meds to heroin. Naloxone, commonly known as Narcan, is the antidote for opioids.
We're yelling at Michael, breathe, Michael, breathe, Michael.
Then 21-year-old Michael Carlson, hooked on heroin, was found by his parents, ashen and unresponsive.
I thought, this is it, this is it. My heart stopped, completely stopped.
In the midst of the crisis,
I have to find the Narcan, I have to find the Narcan.
Tracy Carlson injected her son twice with the drug, made available to her support group.
It was there, and I took advantage of it because I thought, God forbid that I will ever need this, but I want to be prepared.
Toxicology Director Dr. David Abraham at St. Francis Hospital explains how Narcan affects the brain.
So say heroin, a user of heroin used heroin. Heroin went through the body into the actual receptor and bound that opioid receptor. Now, naloxone has the ability to come and push the heroin off the receptor, and that has the at least temporary effect of reversing heroin overdose.
It is temporary, and that's why follow-up treatment is required.
That lasts for half an hour, and then what happens when naloxone wears away or wears off, and the person is going to dip back again and stop breathing, and that's a life-threatening condition.
Patricia Reamer, Commissioner of the Department of Mental Health and Addiction Services.
This is a medication that saves people's lives.
She pushed for passage of the law, making the drug more accessible.
If they are living with somebody, a family member, a roommate, what this legislation allows is for a doctor to prescribe Narcan so that they can have it where the person lives.
So needed, she says, due to the increasing cases of opioid addiction in Connecticut.
We are seeing a rise in admissions to our treatment facilities, mostly in individuals from the age of 18 to 26.
Narcan was the lifeline Tracy's son needed.
And he had overdosed on purpose. And when he woke up, he realized he really didn't want to be dead. And that's when he got serious about his recovery.
Michael is now a drug and alcohol interventionist working closely with families. Commissioner Reamer is quick to point out that recovery is a reality for people addicted to substances and those with mental health issues. Darren?